paying so much for health care, because people are not getting paid to make patients well. Everybody in the system, the insurers, the hospitals, the doctors, the pharmaceutical companies, are all making money by keeping us sick. And, those economic incentives filter down and they change human behavior. And we're not going to do anything without, the easiest way to change behavior is to rationalize the financial incentives.
Right.
Once you do that, everything else is just going to follow naturally. We've developed ways of following the addict for several years and having somebody take ownership of that addict and say, okay, if I pay you as a rehab, I'm not going to pay you, a daily rate so
Right.
that the guy relapses in 2 months and you get paid again. I'm going to pay you one cash disbursement for him for a year, for 2 years, or 3 years.
Yes. And really manage the care.
Right, and you manage all the care.
Yes.
You're responsible for that individual, so if he shows up on your doorstep again, you're going to lose money.
Right, right.
And that gives the economic incentive, the financial incentive to that rehab to do everything in their power to make sure that addict does not return. And when you align the economic incentives with the healthcare outcomes that we're looking for,
Right.
behavior will change.
The value of having some spiritual belief in your life probably is real and significant and hard to replace that. Loneliness is a massive problem. The last Surgeon General's report, he quantitated it as equivalent to smoking 15 cigarettes a day, which I think that's pretty accurate. The impact of substance use, which is often what you turn to if you can't get other connection in your life, and is worsened dramatically by loneliness. These are, if you count lost work days and the like, we're talking about $100 billion a day, including incarceration, maybe $150 billion, not a day, a year. So these are major costs that we're absorbing because we're not taking a crisis, an emotional crisis, on head first. And I point out the fact it's going to have to be multifaceted. You can't just throw money at these issues. I'm telling you right now, there's no question about it, whether you want it or not, the best way to help some of these communities is going to be AI-based avatars. Agentic AI taking the ability to do the intake, just catch the patient, customize to what their needs are, understand what they're up to. If you go, and please go play with these tools, they're unbelievable. They'll pick up subtle little nuances in how you're saying things. If you do it on purpose, it's actually sort of cool to find out. That will alert the avatar, but more importantly, the doctor they're going to report to, that there's something going on. So when the clinician connects with you, and there will always be a doctor, 50% of our cortex is designed to read the face of the person in front of you. I can look at you and tell you're bored, happy, excited, running away, whatever. But before you say a thing, and we're hardwired to read each other for that reason. We're social entities by definition. We got to where we are because we're social entities. So the key question is, how do we use AI thoughtfully in that setting? And if we do it right, we'll build a much more sustainable healthcare system around mental health issues.
Your political position, it differs from that of a federal administration.